gëj a dem lopitaan pour nemmeeku sa wérgu yaram ndax xam nga sa wérgu yaram fu mu toll est-ce que yaa ngi bàyyi xel si li ngay lekka wala exercise bokk na si li ngay sóoraale si sa dundu pour am ci lu la leer toppaleen ñu leen di bu ne si suñ programme yi health check nga xam ne lépp lu ñuy waxtaanee dina méngoo ak sa wérgu yaram.
I am Dr. Hassan AZADEH, a senior lecturer at the University of the Gambia, teaching in obstetric and gynecology, and also I am the clinical director of the MEDICARE clinic. I have been asked to talk about a quite common topic while we are in the Gambia, which we call it infertility. Infertility in the Gambia is quite high. And obviously, when we're talking about the infertility, we're thinking of a woman to get pregnant. And a simple definition for infertility is when a couple, male and female, living together and having regular their sexual core, that they, after 1 year, still there is no pregnancy. So, first advice to that is that infertility after 1 year not getting pregnant it could be from the woman, it could be from the man, it could be even from both sides. But today's topic, we would rather concentrate of the male infertility. We're talking about a man who is married with his wife, and after 1 year still there is no pregnancies. The whole thing started by men when they are becoming in the age of puberty. We're talking about the age now about 12 to 16, they're coming in the puberty. In the puberty of male, of the boys, there are changing of hormones. Some other hormones becoming quite active. The hormones quite getting active, this is the sexual hormones. And the sexual hormone by the young boys, we call it testosterone. Testosterone is a hormone, is a male hormone, which is produced in the testicle of the boys. Once they are healthy and they will have a sufficient testosterone for them to be able, by healthy testosterone, to make a woman pregnant. We're talking about puberty. But when they come to a bit older adolescence, this is the time they are planning to have a family, and they were planning to have a child or children. Once this 1 year we were talking about it past living together and is not, what is the advice? The advice is, do not get frustrated, do not get depressed. The best way is for them to come and seek for help. They can visit the hospital, the clinic where the experts are working. And thank God in the Gambia we have quite a few of them in the government hospital and in the private hospital. They come together with the wife and they say, look, after 1 year still there is no pregnancies. Can you please check both of us to see whether it's the fault of my wife or eventually is for me? This is the best advice to give them. Once they come to the clinic, we have to check both of them. By the woman, we go through all the history of the sexual and menstrual conditions and about the health. And by man also, the very first thing we do a general checkup of the man, whatever the age is. We check for whether there is any diabetes involved, whether there is an hypertension disease involved, or in general health, if you find something, this is something we can start into to diagnose and to treat. What we come across of young men, and many of them in the Gambia, is they might not have any underlying health condition, but unfortunately, they start having the habit of drinking, they start having the habit with smoking. Very much evidently, the alcohol and the cigarette, nicotine, they actually deteriorate the quality of the sperm. It's no wonder that all this time they've been married, there is no pregnancies, and they have got this quite bad habit. We diagnosed it and said, look, if you want to change and if you want your wife to get pregnant, at the very first place, you have to stop this habit you're having. You have to stop the drinking, you have to stop the smoking, and you will have a healthy food, you have some exercise, and you have to make sure that you don't get overweight. That getting overweight, obesity, they suppress and change some human hormones, in particular the sexual hormones. And also, once the woman is being checked and does not have any underlying disease, the same diabetic, hypertension, or she doesn't have any abnormalities of a womb, and she has got a regular menstrual period, then we recommend that the man to do a sperm test. And the sperm test is simply done in most of the lab in different clinics. To do a sperm test, the man, they should stay away, not having sexual contact, for at least good 5 days and nights before coming for the test. Our advice is, this is the best time for the man to think of coming for the sperm test while his wife is menstruating. When the wife is menstruating, they don't have sexual contact. After 5 days and night, staying away from sex, they can come to the clinic and the lab, they can produce some sperm, and the lab look under the microscope to see the number of the sperm, to see the quality of the sperm, to see the movement of the sperm. Once, for example, the movement of the sperm by healthy sperm should be about 60%. And once there is enough in volume of the sperms, and there are no sexually transmitted bacteria, viral, fungal, being seen while you're checking the sperm test. So the result come back to the doctor, to any experienced doctors, and we check all that. Now, if we see any changes of the quality, of the number, of the mobility, movement of the sperm, that is the time we advise them and we say, look, the normal is that kind of percentage. Yours is lower than that. The volume of your sperm, this is normal, is that much. Yours is less. And the quality is less. So we then are able to know exactly what is low and what we can help. Unfortunately, even in the Gambia, the treatment for low sperm even for quality of sperm, they are absolutely available. If the percentage of the sperm, the movement must be about 60%, is about 30%, is half of it or less, we put them on treatment. That treatment called testosterone. Testosterone is a man's hormone, is available in the Gambia as injection, as a tablet. But giving them this kind of medication, at the same time, they have to take our advice of a healthy life. Stop alcohol, stop cigarette, and taking the medication regularly. The next question is, once they accept to take the medication, and once they accept to having a normal, healthy lifestyle, then after using those medications, we request them to come back after 3 months to repeat that sperm test. If they have taken the medication, if they have had a healthy life, healthy food, exercise, we can see success. We can see that the one with 20, 25, 30% during these 3 months, by having this medication, it came up to 60, even more. So that is the time we doctors are happy to have been able to help a couple, for them to, for the woman to get pregnant and having child or children. But the problem is that very difficult condition we have in the clinic, that in generally not many men are happy and they like to come to the clinic. They always think when there is a childless is the woman's fault. But giving you the statistic from WHO recently, about 27% of men having a cause for infertility. That is what we are explained. That need to be diagnosed, and thankfully there are treatment for them. Do not always push the infertility and childless just the woman. Think of 20% of men. And there are solutions. There are ways to make them happy, for the woman to get pregnant. Bring into the clinic just one of them, just the man or just the woman. That is not a correct way of investigating. To have a child, to get a woman pregnant, there is a man and woman. So both of them, they need to be investigated. They need to be given treatment if they need. And of course, the doctors as humans at the same time. Once they are able to help a family in such a way that having a child or children, we are happy at the same time as well. Definitely advise, do not stay away too long when there is no pregnancy, when is a childless. For the man, they should not be ashamed to come with a wife and to be investigated. That is why we are there. The doctors are there, the labs are there, the medication are there. They are available, and there is, if there is a belief those medications are not available in the Gambia, is not correct at all. There are medications for infertility available in the Gambia, for men and for the women. Actually, the whole meaning of having this kind of awareness, this kind of program, is to give some fact, make the people awareness of health, and advise them. And whoever take medical advice, they will succeed with a good health. If there is childless, even then they will have child or children. Not only the man, not only the woman become depressed, become frustrated. Also the member of both side family, they also get depressed. They also get very sad. They also will always blame them that they are married for like 2 years or longer. Still, there is no pregnancies. So take advice and come forward, investigated, diagnosed, and treated, so they will be happy. In one condition, a sad condition, I have to also mention. By men, when they were born as a baby, the glands which produce the testosterone in the testicle, either before even born is not there or is abnormal. This is I call it sad condition, is because once eventually come for investigation, we ask them to do a sperm test and we will check it and we will not find a single sperm in that ejaculate fluids. The lab writes there is no sperm. So for us, doctor, is quite heartbreaking to transfer this information from doctor to the husband, to the man, that look, there is no sperm. We can repeat the sperm again. You can go to another lab to repeat it again as a second opinion. But once is definitely there is no sperm in your ejaculate, you cannot make any woman in the entire world pregnant. Let me give you one practical experience I have not long ago. A man brought his number 6 wife to the clinic, and he wanted that woman be pregnant. I asked him, you have before 5 women, 5 wives before. How long did you stay with them? And did any of them eventually get once pregnant? And he said, no, that is why I divorced them and got married. The man became about 52 years of age and brought the 18, 19 years of age last wife to us. By advice and even by force, the woman asked him to do a sperm test. He did a sperm test, and he was unfortunately type of man whose testicle does not produce sperm. As you can imagine, how heartbreaking it was for me to pass on this message to him. And also advise him, I think you should stop really getting married to somebody else, because this condition will not change. My advice to him, it was, if the wife agrees, to go and adopt a child, whether a baby or a young child. But unfortunately, in some cultures, like African culture, Asian cultures, they do not like to adopt children from the other families. They always want their own child. Yes, we help you to get your own child, providing that you're healthy, providing that your sperm are normal, providing that your wife doesn't have. But when it's come to the condition that is not even single sperm are available, this is the only one. And there are many children in the Gambia. They will be happy to be adopted. And some of the family, even within the family, so do not sit and get depressed and then just getting married to one to the others. Just convince yourself, this child there needs some future. We cannot make children. So, but we are able to take care of that child, making to our own child and giving a chance, giving a life to that child. yes, adoption should really be more emphasized in our cultures. And in Europe, in Western world, the list for the adoption of the children is very, very long. I work in UK, and like about 50 people are at the list and actually ready and begging to get an adopted child. It depends on what they want, it depends at what age, but that is what we should really encourage here, that give the children, when there is no possibility for you don't want your own child, a chance. Give a chance to give them life. And I hope my advice and all the colleagues' advice is the same. And I hope you're taking advice and making the move to any clinic you wish, to see any doctor you have trust, and to us to get investigated, to diagnose, and to help. And we are always happy seeing a couple we have treated, and they come into our clinic holding a child and the arm. We said, that is my baby. Thank you.